Should you be getting morning erections? And how often is normal? Hi, I'm Dr. Maya Benson, urologist and pelvic surgeon. Recently, I shared a clip from my appearance on the Ever Forward podcast, and whoa, sparked quite a conversation. So, I figured it's time to dive deeper into the topic. Why do men wake up with erections? It's a common question, and surprisingly, it's not just about having erotic dreams or sexual thoughts. Morning erections are actually a normal part of male physiology. We call these nocturnal penile tumescences, or NPTs, and they mostly happen during a specific sleep phase called REM sleep, that's the stage when your brain is most active and you dream the most. REM sleep usually peaks in the early morning hours. That's why men often wake up with an erection, either right when they wake or just after REM sleep. Many of you might remember those teenage years when morning wood was almost a daily occurrence. Your sheets probably bore witness. But what about beyond those years? What's normal? The science behind nocturnal erections. The earliest detailed research on this was done in the mid-70s. In one notable study, researchers invited 125 healthy males ranging from toddlers 3 years old to elderly men, up to 79 years old, to spend several nights in a sleep lab. They hooked these volunteers up to machines monitoring brainwaves, eye movements, and crucially changes in penile size. The participants spent 3 nights there, but the middle night's data was considered the most accurate for analysis. They made sure none of the men had sleep disorders, erectile dysfunction, or were taking medications that could interfere with the results. The findings were fascinating. Even boys as young as 3 years old experienced erections during sleep, and the frequency and duration were pretty steady through childhood. Then came puberty, the peak time. Teenage boys experienced the most frequent and longest-lasting erections during sleep, averaging about 40 minutes per episode. To put that in perspective, about 40% of their total sleep time was spent with erections. After puberty, this duration declines, but remains significant, about 20% of total sleep time, or roughly 1.5 hours. Nightly, with erections averaging around 30 minutes each. Most adult men have between 3 to 5 episodes of nocturnal erections every night. What about as men age? It's a common assumption that REM sleep and, by extension, erections decline sharply with age. But studies show REM sleep remains relatively stable, with adults typically getting about 100 minutes of REM each night. A more recent study, involving 40 healthy sexually active men, aged 20 to 60, confirmed that erections during sleep persist across all age groups. However, the quality changes slightly. Specifically, the blood flow involved in these erections decreases with age. Men in their 20s saw an increase in blood flow during erections of around 268% over baseline, while men in their 50s experienced about 200%. The frequency and duration of erections, however, remained mostly unchanged on average. About 3.8 erections, lasting 31 minutes each. Other studies since the 1970s have supported these findings consistently. So, what does this mean for you? Morning erections and nocturnal erections aren't just random or embarrassing. They're a vital sign of your vascular, hormonal, and neurological health. Good erections at night mean healthy blood flow, balanced hormones like testosterone, and a functioning nervous system. If you notice a sudden drop or absence of morning erections, it's worth paying attention. This could be an early sign of underlying health issues, maybe hormonal imbalance, cardiovascular problems, or nerve issues. Changes might also affect your daytime erections or sexual function. The first step is to check your testosterone levels, as low testosterone often correlates with reduced nocturnal erections. But don't stop there. Look at your overall health. Optimizing cardiovascular health is crucial. This means maintaining a healthy weight, exercising regularly, combining resistance training and aerobic workouts, managing stress effectively, and prioritizing quality sleep. All these factors improve blood flow and hormone balance, which are essential for erectile health. Bottom line, morning erections are a biomarker, a natural indicator of your overall health. Declining morning erections shouldn't be ignored. Instead, see it as your body signaling it's time to take action on your lifestyle and health. Bonus: paying attention to this can help you catch problems before they develop into erectile dysfunction or other complications. If you've found this useful, I invite you to subscribe to my newsletter. Every week, I share the latest research on men's and women's urology, answer subscriber questions, and keep you updated on everything happening in the field and in my life. It's free and packed with valuable info. Remember, taking care of your health is taking care of you because you're worth it.